Bismillahirrahmanirrahim. Assalamu alaikum. My name is Sayyid Mama Shair Rahman. The drug assigned to me for today's presentation is intermediate acting insulin, which is the neutral protamine hagedron, NPH insulin. Neutral protamine hagedron insulin is a combination of zinc, regular insulin, and protamine, which is a highly basic protein that exhibits a delayed onset and peak of action. NPH insulin is often combined with regular or rapid insulin. NPH insulin is used for basal control, that is a fasting one in type 1 or type 2 diabetes. NPH insulin should be given only subcutaneously and never intravenously. Another name for this preparation is isopane insulin. What are the main indications? NPH insulin is FDA approved in the adult and pediatric population for the control of type 1 and type 2 diabetes mellitus. NPH insulin offers a sustained release of insulin over an extended period. It is also useful in gestational diabetes. Pregnancy may require higher doses of insulin. We're talking about the adverse effect. NPH insulin has somewhat higher risk of hypoglycemia. There are two types: nocturnal hypoglycemia. The patient is given NPH insulin in the evening. The NPH insulin peaks occurs at midnight when the body does not require as much insulin and may cause nocturnal hypoglycemia. Fasting hyperglycemia. Morning blood glucose can be high in the patient who take NPH insulin in the evening. The duration of action of insulin is not enough to exert its effect till the morning. NPH insulin can cause weight gain. Other side effects include cerebral edema, hypokalemia, and lipodystrophy, which may manifest as skin atrophy or hypertrophy. Hypersensitivity reaction to insulin usually includes a local injection site reaction such as swelling or redness, but rarely life-threatening anaphylaxis can also occur. Toxicity of insulin. NPH insulin toxicity can lead to severe hypoglycemia and can cause seizures and even irreversible neurological deficits. It may be life-threatening or also cause death. Patients with renal or hepatic impairment are at higher risk of having hypoglycemia. The antidote to its toxicity: diabetes mellitus patients and those on NPH insulin should have a source of sugar with them. Severe hypoglycemia and unconscious patients require hospitalization. Patients require treatment with an injection of glucagon or intravenous administration of glucose. Dosing of NPH insulin. Type 1 adults, usual daily maintenance range is 0.5 to 1 unit per kg per day subcutaneously in divided doses. Non-obese may require zero point 0.4 to zero point 0.6 units per kg per day. Obese may require zero point 0.8 to 1.2 units kg per day. Pediatric in type 1, less than 12 years, safety and efficacy is not established, and above 12 years, suggested dose is zero point 0.5 to zero point 0.1 unit per kg per day subcutaneously. Use adult dosing. Usual daily maintenance range in adolescents is less than or equal to 1.2 units per kg per day during growth spurts. In type 2 adults, suggested guidelines for beginning dose is zero point 0.2 unit per kg per day. In morning, give 2/3 of daily insulin subcutaneously. Ratio of regular insulin to NPH insulin is 1:2. In the evening, give 1/3 of your daily insulin subcutaneously. Ratio of the regular insulin to NPH insulin is 1:1. Drug interaction. The first interaction is the pramlintide. Pramlintide is contraindicated and must be administered separately. The mechanism of the interaction is still unspecified. Ethanol should be avoided or use some alternate drug. Alcohol may either increase or decrease the blood glucose, lowering the effect of insulin. Alcohol may decrease the endogenous glucose production, which may increase hypoglycemia risk or worsen glycemic control by adding calories. Aspirin increases the effect of insulin NPH by pharmacodynamic synergism. We may have to modify the therapy or monitor it closely. Co-administration of insulin with high doses of salicylates may increase risk of hypoglycemia. Insulin dose adjustment and increased frequency of glucose monitoring may be required. Alternative brands. There are 3 alternative brands: Humulin, Insuget N, Insuget N, and Insulotard HM. Humulin N is available in rupees 861. Insulet N is available at 649 rupees, and Insuletard HM is available at 756 rupees. Irrational use of insulin (NPH). With some individuals who struggle with type 1 diabetes, insulin can be misused or even abused. This may be due to the influence of an underlying eating disorder such as bulimia nervosa, in which a person is attempting to compensate for a binging episode. Withholding insulin needed or using excessive insulin is extremely dangerous and can present serious medical complication in a person affected by type 1 diabetes, often referred to as diabulimia. Insulin misuse is characteristic of this condition. Now coming to the case studies. A 50-year-old male patient presented to the emergency department at 2 a.m. with vomiting and abdominal pain. He had 2 weeks history of polyuria and polydipsia accompanied by a 20-pound weight loss and blurred vision. His medical history was unremarkable except for being treated for hypertension with amlodipine 10 milligram daily, which provided good control. His blood pressure on admission was 135 by 80. Results of hospital laboratory studies revealed that the patient's initial blood glucose level was 1192 milligram per deciliter, and clinical presentation and laboratory findings were consistent with the diagnosis of diabetic ketoacidosis. The patient reported no family history of diabetes. So, notes: subject, the gender of the patient is male, his age is 50 years, chief complaint is vomiting and abdominal pain. Medical history: 2 weeks history of polyuria and polydipsia accompanied by 20-pound weight loss and blurred vision. Being treated for hypertension with amlodipine 10 daily. No and no family history of diabetes. The objective. Coming to the objective, blood pressure on admission was 135 by 80. Initial blood glucose level was 1192 milligram per deciliter, which is very high. Laboratory findings were consistent with the diagnosis of diabetic ketoacidosis. Acute onset of diabetes with classic symptoms of insulin deficiency compatible with diagnosis of type 1 diabetes. Approximately 25% of patients that present with diabetic ketoacidosis have new onset of type 1 diabetes. Coming towards the plan, an insulin regimen should be designed for ease of administration, consisting of a pre-mix 70 by 30 mix before breakfast. In the evening, the evening insulin regimen includes regular insulin before dinner and NPH at bedtime, because the peak action of NPH is expected approximately 8 to 10 hours following the administration. Giving the evening dose of NPH at bedtime rather than before avoids the nocturnal hypoglycemia that is often associated with dinner time NPH administration. Patients should be instructed regarding the diet, medication schedule, and home glucose monitoring. That's all from me. Thank you. Allah Hafiz.